Hello, everybody. First, want to congratulate you guys on making it. We got about 3 weeks left, and you're doing great, you're working hard. I really see a lot of progress in the quizzes and the homework, so which is awesome. You guys just keep up the good work, and we'll get through this. We're almost done, and then we'll move on to the next course. Which is a lot more fun. We get to actually look at images. Towards the end of this course, we'll look at some, but the next course, we look a little bit more images and different things like that. But we just finished up chapter 9 and 10. Excuse me. Chapter 9, image quality. Huge thing. It goes along with quality assurance, but we want to make sure that we know what we're looking at when we look at the image. And if it's something that's there, like an artifact, which would be an unwanted part of the image that obviously you don't want there. For example, in X-ray, if you have a blur because of motion, the blur would be an artifact because of the motion. In CT, one of the main artifacts that we deal with is streaking. Motion can cause streaking. Different metal prosthesis can cause streaking. So the key thing is recognizing the streak or recognizing the artifact and knowing how to fix it. A good example is just today I was at a hospital and one of the CT techs asked one of our senior students how to fix the streaking artifact in a knee CT. He was performing a knee CT on a knee that did not have a knee replacement and the other one did, and she just told him, well, just move the other knee out of the way, just kind of have them flex up their knee. Worked out great. I was very proud that she knew that answer because we do hit CT, and the ETSU program, just as I know Tammy and her program does the exact same thing, which is awesome. Obviously, I'm very biased by that statement because I'm registered in CT, but it's the key is it's finding that image quality and recognizing what you're looking at. We also talked about low contrast resolution, which is huge. CT wise really improves the contrast, but we want that low contrast resolution because so we can see the very small, it increases our spatial resolution because we can be able to see that very small tumor that might be growing, maybe even prior to stage 1 cancer, and then we need to see that in our CT scan. I'm not going to make this video near as long as the last one because I do apologize for going there just a few more minutes, but I do want to talk about noise as well. Noise is like a lot like quantum model, but it's very pixely. You can kind of see that. How you improve noise is you probably increase your KVP in CT. That's a good way. You can center the patient a little bit better. Different things like this. So there's a lot to image quality. This is just a scrape of the iceberg, if you will, regarding image quality. There's so much depth to it. We don't get necessarily real deep into it because you might see like a ring artifact that could be caused by a detector going out or has gone out. That is something we don't fix. We call the engineer and have them come take a look at it. So that's, really dig deep into the image quality, but don't necessarily do it in the textbook. Know the basics for the textbook, but if you're going into CT, have somebody show you some different artifacts on the images, and then that will help you determine, hey, I know what I'm looking at. Okay. Chapter 10 talks about radiation dose. In X-ray, CT, nuclear medicine, different things like this, we use radiation to create the image. That is a risk, a benefit risk analysis to, do we X-ray the patient? Do we CT the patient? Do we use ionizing radiation to get the diagnosis on the patient? My first answer is yes, we do. We have to do that because that's what creates our image. However, as good radiologic technologists and quality healthcare professionals, we have to limit the dose to our patients. A lot of different things out in CT nowadays that limits the dose. There's a lot of different programs that are run to where you can actually scan your patient on a lower dose, and then they apply different filters over it. Makes great image quality. Still has a long way to go, but a lot of the newer scanners out there nowadays are really getting into that, which is great. That's very, very good. But you just want to kind of make sure the dose. And the key thing about dose is do not get drawn into what the media is telling you. Okay, there are case studies out there of very bad radiation dose. You will see I believe one of the big ones is there's a baby with a ring artifact around their head because where the hair has been actually burnt off because of the amount of radiation. That gets into protocols on your scanner. We'll talk about a little bit about that in the next class, but if we're just to touch base on it, there are protocols for pediatric patients to geriatric patients, and you need to know the difference between the two because that is going to prevent your patients from getting dosed. This dose is no different than x-ray dose when you're doing something as simple as a chest x-ray. You want to shield your patient, but in this case, you shield all the way around, okay? Because the tube goes all the way around the patient. So if you just place something on top of the patient, you want to shield their pelvis, maybe their abdomen, because you're doing maybe a head to chest, which is fine. You can do that. Shield the abdomen, but you have to shield underneath them as well as on top of them. So make sure that you recognize that. So moving forward, we are getting into chapter 11 and 12. 11 goes into the multi-slice scanning, and that's what we use today. Volume scanning, cone beam, different things like this. Get into this chapter. It is a very exciting chapter. I know I'm a nerd. Thank you. But it is very cool because this is today's technology. Multi-slice scanning is pretty much what we use all around. I know in Central Illinois there are anywhere from 16 slice scanners to 160 slice scanners and everything in between. So get used to hearing that different things because that is what the slice is. That's the slices, the image that we take as the tube goes around the patient, and we can take multiple slices at each individual time. Then we get into chapter 12, which talks about kind of the advanced imaging of CT. A couple of things I want to hit really kind of bring to your attention are cardiac CTs, CCTAs, the coronary artery CTA, the CTA in general, which is a computer tomography angiography scan. We single out specific blood vessels that we want to look at. We use contrast for it. There's also different things for the CT scanners, like a CT screening for lung cancer, and all sorts of different things for CT scanning for radiation therapy, different things like that. So it's a very interesting chapter. Kind of gets into the basic principles of the advanced of CT and different things like this. So that kind of gives us a overview of this week. I know it is Thanksgiving, so shouldn't be, these two chapters are very light. Should be pretty simple for you to get everything done by Monday at 8 a.m. But I do want to take this opportunity to wish each one of you a very happy Thanksgiving. Please be safe and enjoy your time with your friends and family during this time. And again, if you have any questions, don't hesitate to email me, text me, just get a hold of me one way or another, and we'll get everything worked out. I do know last week there was an issue with the quiz. For some reason, it was not showing the appropriate answers. I did fix it, but if you still have an issue looking at the quiz, I did reset the quiz. If you still have an issue, please get in contact with me, and we'll see what we can do about that. So have a great Thanksgiving, and I will see you guys in 1 week. Have a great day.